Hello and welcome to Curated Conversations, a podcast by the Grand Rapids African American Health Institute, where we talk all things health and wellness. My name is Ashley Starr, and today I am joined by someone who's no stranger to the podcast, Dr. Tiaja Jordan. How are you?
I am well. It's good to be back. I think the last time I was here, I was Tiaja Martin. So,
yes.
Hey, everybody in the interwebs, I've changed over 2 times. I am now Doctor, and I am now a Jordan.
I know that's right.
All right.
Now, we do have a guest joining us today, and I am very excited. This man needs no introduction, but for some of you that may not have had a chance to interact with him, I'm going to give him the floor to kind of give you the opportunity to learn a little bit about who he is. And if you're late to the program, we will not judge you, but we will hold you accountable. So, Doctor, and I love calling you Doctor because that's how I felt about you when I saw you on stage at the Giant Awards.
Yes, fellow Giant.
Lee Jackson. Welcome to the conversation.
Thank you. I am glad to be here
Yes.
to have this conversation.
We're glad to have you. So tell everyone a little bit about yourself, what you do, how long you've been doing it, so they can kind of get to know you if they haven't interacted with you before.
Yeah, that's a good question. I am actually born and raised, so I'm Grand Rapidian. I'm the current president for the Greater Grand Rapids branch of the NAACP, and also I have the unique fortune to serve as an area director for the Michigan State Conference NAACP as well. And so have been in that role. It was 10 years as the president.
Wow.
For 2024 was my 10th year, which I did not expect that at all. Didn't want to do it. Didn't see that coming, but we're here. And so just super excited to be able to serve all of Kent County in this role. So,
Isn't that the true story of every leader? Nobody wants to do it all the time, but somebody ends up doing it, and
Right.
time just gets away from them.
Exactly. Well, we have no better person to be on a podcast to talk about those things. So we're going to jump right into it. So when it talks about the impact of healthcare legislation on the Black communities, how has recent legislation helped or hurt Black Americans?
that's a tall question. So when we look at, I think about the Affordable Care Act and its impact on making sure that hundreds and hundreds of thousands of people are now insured because of that act. And it expanded that folks who were insured significantly. And so I think that is one piece of legislation that has to be really lifted up. And what's interesting, too, about that is the fact that now we have this current administration who is looking at and trying to do everything in their power to eliminate that coverage for millions of people. The other interesting thing is that although a number of people were insured and because of this act, there are still many millions who are uninsured, right? Who are uninsured or underinsured in this country. Even when you think about, I'm looking at this in Michigan, over 2.6 million residents are covered under Medicaid or the Healthy Michigan Plan, which significantly improves access to affordable, efficient, and quality health care.
Right.
Which is the foundation of making sure that our health outcomes, that we're getting the best health outcomes that we possibly can get. And so those are, I think, a couple of the things that I would definitely lift up. And then the other thing I was looking at when I was kind of doing some research on that, we still have states, I think there are about maybe 14 states that have decided not to expand Medicaid specifically. And so that's interesting in itself as well, right?
Do we know why? Like, what's supposed to be the plan behind that, or how that helps?
You know, that's a good question. That's $1 million question.
Right.
Because you would think that all states would want to make sure that their residents are insured. I think it's politics, definitely politics. I think it's the left versus the right, and progressive versus conservatives, and all of those things at the cost of people.
Yeah.
Because these are real lives, right? And then I think some of the Republicans would say that, it's too expensive. and it's a waste, it's an abusive system, and those sorts of things. There are some questions around fraud as well. And so there's a lot of conversation around that, of course, as we know with this new administration and the new Secretary of DHS or HHS. So that's just real interesting. And so those are a couple of the things that I would say in terms of huge legislative wins that this country has had.
So in that, what are some misconceptions that you are aware of that most people have around Medicaid support? And I'm not sure if you all have ever had a conversation, but what are some things, some actionable things people can do right now with some of the uncertainty?
You know, I think we really need to look at this from a local and a state level.
Yeah.
And what I mean by that is really leaning in to your local elected officials, both on the city, on the county side, and the state side, and making sure that we are amplifying the needs of community, period. And also, I think we have to understand as constituents that these individuals are elected.
Yes.
They're elected. And so one of the things from an NAACP perspective we have every year is we call a advocacy day. And it's really a day of action at the state capitol. And so there are hundreds of us that go. We partner with Jack and Jill of America now. We partner with the Divine Nine,
That's
the
good.
Links. And we spend the entire day talking about key legislative issues. And then we spend a portion of that day visiting our state reps, both on the House and then on the Senate side, and just really talking about locally what are some of the issues here, and making sure that we could try to, at some extent, put some guardrails in place, because we know what's happening at the federal level.
Right.
We know what's happening. So we have to advocate like hell at the state and the local level to make sure that our voices are being amplified and that these key issues are staying front and center. So that's what we can do.
Okay.
And I also think that it's staying tapped in. I think not getting overwhelmed, because it's a lot to be overwhelmed about. And then the other question is, when I say stay tapped in, do something. Whether it doesn't have to be with the NAACP, that would be my choice. But you have Divine Nine, you have the Urban League, you have NAN, you have
What does NAN stand for?
National Action Network.
Okay.
You have the Hispanic Center, you have the Asian Americans, you have GRAAHI. Volunteer, get involved. And those are the sorts of things I think that we need to do, and we need to pay attention. And so I think oftentimes what happens too is we're doing damage control instead of being preventative, right? Instead of showing up at city council meetings and county commission meetings and school board meetings and actually understanding what's on the agenda. And then bringing that back to community, so then we can put a strategy around how to respond to those things.
Yeah, that's powerful. I feel like most people have adopted this helplessness feeling, like my legislators and my elected officials aren't listening and my voice doesn't matter. I feel like that's become like a community-wide negative mindset that people have. So thinking about someone who's 65 versus someone who's 25, the younger person may feel like they have no influence in community, and our seniors may feel like, I'm tired. So what would you say to the two of them to activate them? One, I think I heard him say, Ashley, did you hear him say join the NAACP?
Right, yeah.
Okay.
I think I heard that as well.
Okay, so I think that's an option for both parties, right?
NAACPGR.com.
Okay. So
Shameless plug.
for the third time, we'll say that again. But what is, and I think I heard you say to going to these meetings, but what do they say? Like, how do they activate, or if they are incapable of physically going, what does it look like for them to do something else? Like, what's the list of things they can do just to start moving the needle from their one address?
You know, I think, and I tell people all the time, when we ask volunteers to show up, at these meetings, you actually don't have to say anything. We want you to listen. We want you to bring that information back. So at some point, there will be a time to say something, but you won't be alone. You won't be by yourself. Okay. And so, but we want you to be there, again, trying to be preventative and proactive, understanding what the issues are, what's at stake, and then bringing that intel back to us where we can discuss at our membership meeting or at the executive committee and say, how do we put a plan of action in place to address this issue here, right?
That's good.
And so, and also for those individuals who are not mobile, city commission meetings are virtual as well. Okay. I think they broadcast them on the city site. So there's really not an excuse. I know some people would say, technically, it's like, technology, I should say. It's a little challenge, but get somebody to assist.
Yeah.
Tap into your resources. And that's what those are the things that we can do. And if you're not able to get online, pick up the phone. Okay. You can call your city commission members. You can call county commission members. You can call the governor's office. You could call your reps on the House and on the Senate side. And so there are a lot of things that you can write a letter if you're old school. You
should write a letter. We want that paper trail.
Paper trail, yes. That's how
even if it's something even if it's something as simple as saying, we are watching you.
Yes.
Right? Because at some point, though, all of these individuals will come back around.
Yeah.
Because they need our votes. And so when they come back around, when they show up at our churches,
that's good.
We can say, but you didn't respond, right? When, I think about maternal and infant health, and I know you guys, GRAAHI is really focused on this, and Black maternal mortality rates remain at 2.6 times higher than those of white women. That's a problem, and there was legislation that was coming through, I forget the House bill, at the state level, specifically to address infant maternal health.
Yes.
Right? And quite honestly, it was sitting on the governor's desk waiting to be signed. And so I'm not sure. I was actually going to reach out to one of the reps before I got here to see if she actually signed that piece of legislation. But those are the types of things that we need to pay attention to. So when these folks show up, and I respect Governor Whitmer, and we've had a long relationship, but there are things that are critical to our community that have to get addressed. And that's one piece of critical legislation that, quite honestly, we should have stayed on top of it when it was introduced. And unfortunately, we didn't. And at the 23rd hour, it was waiting for her signature. And so those are the types of things that we can do, just kind of paying attention. And I think we're going to do a better job as an NAACP unit to really stay on top of these things instead of waiting to the end of the year. Right? Or the very beginning of the year when the governor comes and she speaks at an Urban League breakfast, right? And no one challenges her about this critical piece of legislation that she had 24 hours to sign or 48 hours to sign. So I love that you bring that up, because let's just talk about it. There is no way to have this type of conversation without talking about the racial disparities in access to care. Like I know people try to tiptoe around it, but it just is what it is. You know what I'm saying? So when we talk about that, like, can you talk about how the health disparities manifest when we talk about access to care or lack thereof? Well, you look at the asthmatic rates, and I have here Black Americans are 40% more likely to have asthma than white Americans. Black children are 8 times more likely to die from asthma than white children due to higher exposure, environmental exposure, because where train tracks are located, they're not in East Grand Rapids.
No,
they're not in Cascade. They're right down by Hall and Madison. In the Black Hills section of the city. Well, who lives there mostly? It's us. It's black and brown folks, right?
Yeah.
And so when you look at the emissions, where are highways placed, right? We have the only now in the state of Michigan incinerator right over here on Wealthy, the Kent County incinerator. And that pollution is blowing where?
Right in this neighborhood.
Right into 49507, right? And so, and the good thing about that is that there was a package of bills around clean energy. Okay. And through the state. So they referred to the Kent County administrator or Kent County incinerator as a clean source of energy.
Interesting.
Right. And so what is that about? Right. So there were a number of people, of course, including us, who were taken aback by that. And then we had Rep. Fitzgerald and Representative Grant do an amendment to that legislation. It still referenced it as a clean energy source, but the critical piece is they did an amendment where now they have to close that incinerator down by a certain time period. Okay. And it might be 2040 or 2030 something, but anyway, the point of it is that it must be shut down. So there is a sunset period. So that's a good thing. And those are, the type of pieces of legislation that we need to really be mindful of and stay plugged in and leaned into. So you talk about, when you look at healthcare disparities, it's almost, it was interesting because I've been having this conversation for years. I've been in healthcare my entire career. And there have been many folks that have said to me over the years, why do we always have to have these high levels of disparities in every, like literally every category, right?
Right.
And so the fact of that is that because it's lack of access to affordable, efficient health, quality health care.
Yes.
It's lack of access to fresh foods and healthy food.
Yes.
It's lack of access, again, to clean air. A lack of access to a whole lot of things. Education. Education, literacy, housing, yes. And so all of those things. So the disparities run rampant in all areas. So even when you look at the mortality rate for cancers, we don't have a higher incident rate than our white brothers and sisters, but we have a higher mortality rate.
Right.
Because oftentimes when we present, it's at that fourth stage.
Right.
And again, we know a lot is due to mistrust. We're not included even in research trials.
Right.
We don't want to show up because of that mistrust. And so all of those things have an impact in terms of racial disparities.
I think the preventative care side of the conversation is where a lot of people don't understand that they hold the power. To the two statistics that you brought up about maternal mortality and asthma. I have asthma. Mine is seasonal. And right now, the statistics that Ashley and I learned coming back from this last conference, as a African-American woman in childbearing age with me having a terminal degree, my likelihood of coming home after having a child is on par with a white woman of an 8th grade education. So me thinking about having a baby right now in real time, like this isn't some far off thing. It's very real for me. So the data and the preventative spaces are important. So understanding that hypertension being a norm, we talk about high blood pressure, we talk about sugar diabetes all the time. We've normalized being big boned, but those three things, obesity, hypertension, those are all preventative things that I had no idea I could control that and kind of take a step in if I don't want to spend my time talking to my doctor. And that's where I started to understand where GRAAHI's role in that preventative care space, why our doulas are so important. That's really now starting to ring in my head as we're having this conversation.
Mm-hmm. We all know like the many problems and issues that are going on. So what do you think, like what are some community-based solutions that are making a difference? Like Tiaja just mentioned some of our doulas. That's the way that we are trying to make a difference in the community. How about other resources such as like grassroots, telemedicine, Black-owned practices?
All of those,
Yeah.
all of the above. Telemedicine, it was interesting. Telemedicine, I really took off, in my opinion, during COVID.
Yep. Mm-hmm.
And so, but it was interesting because I had worked with these brothers out of Detroit, out of the Southeast side, called Mobile Care 247. And this was probably 10 years ago. And they had started this whole telemedicine business, really trying to present it. We talked about it, met with them when I was at Blue Cross, trying to get them a audience. There was a lot of pushback. It was just like tons of pushback. And I'm not even sure if they're in this now. I need to reach out to see. I'm not sure. But telemedicine access increased by 65%.
Wow.
During the COVID-19 pandemic. And by the way, we're still dealing with COVID.
Yes, we
Yes,
are.
we are.
We're talking about it like it's over. It'll never be over. And so just that stat in itself, it really amplifies how healthcare access and healthcare outcomes improve specifically in the Black community and other communities of color. You talked about definitely Black-owned healthcare practices. Let's just be honest. Yes, we definitely need independent practitioners, but we need people within the healthcare system that look like us. You know, we need more Black physicians. We need more Black nurse practitioners. We need more Black just clinical staff, researchers.
Yes.
In places like Corewell Health, University of Michigan Metro, Trinity Health. We need more Black researchers right up here down the street in Van Andel Institute, VAI, because there's a sense of familiarity.
Yes.
There's a sense of cultural, I don't even like the word competency, but context.
Yes.
That's more important because here's the deal. Every 50-plus-year-old Black male does not interface with the healthcare system the same.
Right.
Because I've had my lived experiences. My entire career has been in healthcare. So I know the importance of having a primary care physician.
Right.
I know the importance of having certain tests, diagnostic tests done. I know the importance of having a relationship with all of my medical care providers, even that sometimes I may not want to listen.
That's the next piece.
Right. But so that's really what we need. That's really, really what we need. And I think you guys are going to be, I get questions all the time. Where can I find a Black OBGYN? Or where can I find a Black male or female derm? Or cardiologists or psychiatrists and stuff like that. So I think you guys are going to be working on the manual or directory.
We do have a directory, so you can go to GRAAHI.org. I'm looking directly in the camera. No, people can go to our website and they can look at our directory to get a list of physicians of color to tap into. I'm not sure if you know, but actually that's the whole mission of our department, is to raise up the next generation of leaders in healthcare. So if you're a high school student at any GRPS school, if you're in East Kentwood or at any KPS school, or if you happen to be outside of those two districts and you want to work in healthcare, send us an email at pathways@graahai.org GRAAHI.org, and we would love to work with you. We have scholarship support available for our high school students that are looking at post-secondary education, and that includes certificates. We've learned a lot now that some of those entry-level clinician spaces that you're talking about, a certificate can get you in the door. And that's what we need more of, is more of those people in those front-facing spaces, sitting in front, working their way up. So connect with us if you would like to get into healthcare. And if you're 50 plus and need a career change, work with us, because we want to support you, because we need that now. I think the nurses in the next 10 years, we're about to see a huge retirement of nurses across the country, and we don't have the students to fill that space. So even if GPA is a barrier, career change is a barrier, don't let that stop you. If you want to work in the space, come join us. So we've talked about things at the federal level. We've talked about some things at the state level, but let's zone into what's happening right here in Kent County. What are some of the disparities that you've seen? And I'll kind of dovetail and talk about what some of the things GRAAHI has been trying to touch on, but I would love to hear from your point of view, what community has brought to you, or what you all are trying to push to community as issues.
So, great question. And I think it's important, because sometimes we can be way up here and let's bring it back down. So at the county level, and this is real data and research that was conducted by a healthcare organization, I think all of the hospital systems were involved in this. But I find it interesting because when you look at healthcare coverage and insurance disparities, so it says Black residents in Kent County have 26% fewer insured months per capita compared to white residents.
Wow.
Medicaid in Michigan, or Medicaid expansion in Michigan, has covered over 700,000 residents, reducing uninsured rates, which is significant, again, as we kind of talked about that. And also the ACA, again, significantly reduced uninsured rates for Black communities. When you look at chronic disease, diabetes, the prevalence is 18% higher. And we're talking about Kent County among Black residents. Asthma, the prevalence is 18% greater among Black residents. Depression diagnoses are 33% more common among Black residents. And honestly, I think that is way low, because most of us are not presenting and reporting.
Correct.
Because there's a stigma.
Yes.
And you know the stigma in the Black community is, I'm not crazy. I don't need to talk to anybody. I go and talk to my pastor.
I'm going to talk to the Lord about it.
I'm going to talk to the Lord and leave it there. Which is a significant issue that we should be concerned about. And you wonder why, and I was going to say young folk, but many older folks are running around here really struggling.
Yes.
Because they actually are not tapping into the systems that actually can provide some relief and some help.
Yeah.
When we talk about disparities, we know all of these things, these chronic illnesses, can be a death sentence. But I think many times what we ignore is stress.
Yes.
The silent killer.
The silence, exactly. And I say that about this whole environmental and climate justice piece. It's a silent killer.
Yes.
And people, especially people of color, and Black folks in particular, are not really focused and leaning into the impact of environmental and climate justice on their everyday life, because you can't see it.
Yeah.
You know, as my stomach growls.
No, I think that is really the challenge for us as a people in a community, is that trust space. One of the points you brought up earlier were social determinants of health. One of the things that I know, and I've seen just from community, this isn't backed by a study, but a lot of us are underemployed, which means we're working multiple part-time jobs. If you don't have a full-time job, that does not include health insurance. So your access to care, now you're probably in that percentage that you mentioned that has some type of Medicaid coverage. The idea of needing to go see a therapist to take time off from work, or that your diagnosis could pull you away from any other obligations that you're trying to double dutch and do. That's where that stress comes in. So I think the challenge, and I'm curious to hear how you may position a solution. Living in this state of mistrust is literally making us sick. Mm-hmm. And I don't want to bypass that. How do we, or what would we encourage our community to start building trust in some of these organizations? It may not be this doctor, but how can they start establishing trust to really extend their livelihood?
That's a loaded question. That
Only because you have the expertise and you've been around healthcare, right? Like some of us have family members from seeing this Tuskegee experiments.
Yeah.
Right. So we've been groomed in the mistrust, seeing the system fail us so many times. We've been groomed to not trust. But now we're talking about how do you activate? But if you're activating with that seed of mistrust, like how do we shift that for the listeners?
I think it's important to have an advocate, because there are many folks who are terrified of seeing a doctor, going to a hospital, being in the hospital. And so I think if you are one of those individuals, you really need to plug into an advocate that can help you navigate these systems, and an advocate that is not afraid to ask the right questions.
Yeah.
Right?
Yeah.
Because it is their responsibility to answer and to give you fact-based solutions to your questions. You know, I remember my mom, before she transitioned, she didn't believe in generic drugs at all. She was just like, nope, I do not want a generic. And when they would make the mistake in giving her a generic, she would lay them out. Ooh. And what are you trying to do? Kill me? But that was her thing, you know, and then it didn't matter, you know, you would say, Mom, this is the same equivalent of this. She didn't want that generic drug because she felt that it wasn't. And so we had to advocate and say, hey, this is why she feels this way. Can you just explain to her in detail if there is a difference in that sort of thing? And that took time, but I would recommend you have to have an advocate. Okay. I think if you are mistrustful of this system, and again, many people are, you really have to have an advocate to help walk you through that until you can build some level of a relationship and trust up with that physician, right? And don't be afraid to ask questions.
Yeah,
you know, a lot of times people are just afraid. You know, no, this is your body. The relationship goes both ways. I don't care if this young lady or young man, if they have a MD or a DO, that's your body.
Right. And
so you have 100% say in what happens in the direction in terms of how you want to proceed in this system. But again, as we talked about earlier, I think it is critically important that these systems really recruit and retain people of color in those systems. Yeah. Now that's a whole nother conversation, a whole nother podcast around DEI, right? But I think that's it. And also to reach out. That's why we have organizations like the Grand Rapids African American Health Institute. Yes. In order to reach out. Yes. That's why we have organizations like the NAACP or the Urban League or a Baxter Community Center. Yes. So that our places of trust and confidentiality, and when individuals are running into those issues, you can always come to us to serve as an advocate for you. Yeah. And walk alongside you in these spaces that you may not trust so much.
That's powerful.
Yeah. So when we talking about the roles of advocacy and solutions, how can the listener step forward to push for better healthcare policies at every single level, like not just at the local or the state, but every single level?
Again, as I said earlier, getting involved. I think, because here's the deal. The reality of it is that from an NAACP perspective, especially serving as a president, I can't be everywhere.
Right.
It's just one of me. That's why we need people to volunteer. We're actually really getting ready to, and if people want to, I would love to have volunteers for this, our health committee. So we're really getting ready to ramp that up again. And this young lady had reached out, and she's been a phenomenal mom. Her daughter has some very severe disabilities that she was born with. And she had reached out saying, I want to help be an advocate for other moms and dads.
Yes.
And really help them understand how to navigate through this scary system called health.
Yes.
Right? And I said, you should be our chair for the health committee. So I'm going to be getting with her. And we really, really, especially I think in these times, really need to get back, because we had a very robust health committee for a number of years. And, you know, we used to do the Let's Talk Health Week, Body and Soul Blue, and then that morphed into Faith and Wellness, the Blues Community Challenge, which was a 12-week challenge focused on the faith community around physical activity, and did a number of different tests. And so really want to kind of get back in that space. And then also, because we're not a healthcare provider, but we are a policy institution, right? And so that's where we look at it. Okay, where are some of the things as we are raising the level of awareness, educating our folks, our community, increasing that literacy level, but from a policy perspective, where do we need to be? And what are some of the things that we need to be talking about and discussing? And so I think those are some of the things during this advocacy day, and I don't have the exact date. It might be May 7th, but I can, if folks call us or they visit our website, we'll put it out there. That's an opportunity to lean in and to join us at the state capitol that day. Lansing is only, a 45 minutes?
45 minutes up the street.
Up the street. And so I think those are the types of things that matter. Just get involved. Get involved.
If there is anything I learned from you today in this episode, it was to lift my voice. I think all of the conversation around the disparities, the changes at the federal level, all these things have been overwhelming myself and people around me. But I think today you reignited that value of my voice. Hearing that my letters matter, hearing that there is no age where a person can start standing up for themselves, standing up for the community. Now knowing that I can go back and tell some of the seniors that say, nobody wants to hear me talk. Now I've got things to tell them that they can go and do to contribute back to the community. And now I want to say for the last time on this episode that all of us should go and join the NAACP because it's important. This is where our community legacy has always been connected to. But knowing that everybody can advocate, y'all even send your letters to us at GRAAHI. We'll pass them on. I promise. Like leaning into these community orgs, like you said, Baxter Community House. There's places I'm sure somebody trusts something. And if they at least are listening to this podcast, that means they trust us. So we'll pass the information on. Yes.
Right. And you know, another place, especially when it comes to seniors, that I did mention is the United Methodist Community House.
Yes.
And they've been around for years.
They have.
And so, and they have a very robust and dynamic senior program.
They do.
And so, again, put them on the list. If you know, reach out. Yeah. And I think that one of the other important things, again, and I feel like I keep saying this, people just need to get involved.
Yes.
And if you see an organization like the NAACP and you have some criticism or you feel like we're not doing enough, well, the best way to help us is to get involved.
Right.
Yes.
Our membership meetings are the third Tuesday of the month at 7:15.
Okay.
They're hybrid, which is tonight. So we invite, you can go to our website. You can go to any of our social media platforms and see the link. But it's hybrid, so it'll be, if you can come in person, you can come in person. If not, you can access the link. And that's the third Tuesday of each and every month. Because we need soldiers. We need people who are not afraid to be out here, but doing it in the right way.
Right. Yeah.
And so, yeah, that's it. Can I mention one more thing? I don't know how much time we
Okay.
have.
Go ahead.
I found this really interesting, but it's real, and I don't think we think about this in terms of when we were doing the research to be here today, and frailty and aging disparities. And I think this is really interesting. Black men and women experience frailty levels at age 55, equivalent to white individuals who are 13 to 20 years older. Higher frailty rates indicate accelerated biological aging due to chronic stress,
Yes.
inadequate health care,
Yes.
and socioeconomic disadvantages. And I don't think we pay attention to that.
No.
And so, as I'm among family, so I'm going to say, as we always say, black don't crack.
Oh,
That's
it's
literally
cracking.
what I was thinking. That is literally what I was thinking. On the inside, just cracking on the inside.
Exactly. And I'm looking at this when my team brought this to me, and I thought about it, and it hit me personally, and I said,
Because it's hitting me now. I'm thinking
I
about it.
said, that's me.
Yes.
I said, and I gave them the example. I said, now I had been physically active my entire life, running, swimming. I mean, running at least 5 days a week, working out 5 days a week, swimming at least 3-4 days a week.
That's
and
a
this
full
was
body workout.
in my, high school and growing up in college. And when the pandemic hit, it's like it crashed.
Right.
It totally went away. And I can see and feel the effects of that. And so, and when I thought about this, and they brought this to me, and I'm like, Clee, you got to get back on game.
Yeah.
And I think a lot of us,
Yes.
because we're so distracted
Yes. Yes.
by, just trying to make a dollar
Out of 15 cents.
out of 15 cents, working, overworking ourselves, stressing out about all of these other things
There we go.
that's coming down at the, not only from the national level, but the stuff that's going on here, as well. And just in not really doing that, leaning in, I should say, into our own personal self-care.
Yeah.
And I thought about it, and I said, me personally, I got to get back on the game, because it is too much work and too much stress not to really take care of yourself.
Yes.
On all levels, eating right, hydrating yourself, working out. And even if you have to do it at home, in the pandemic, one of the things I did do, I got some barbells and my yoga mats, and, I was trying to do some things, but it was kind of hit or miss. And, but I'm like, we have to, because it's a fight out here.
Yes.
And we have to be our best at all times. And then a lot of that too, a piece of that is why that frailty comes into play is mental health.
Exactly.
Because we're not mentally taking care of ourselves. We're not willing to acknowledge. We ignore the stress and the pressure that we're faced with each and every day, and we're unwilling to sit down with professionals to be able to unpack those things instead of, hanging around with friends and families that say, "Oh, bro, you good, you good. You don't need any of that."
Right.
You good. And so I just thought that was interesting, because literally this was the first time that was lifted up for me, that whole frailty piece. And I'm like, ooh, just like you said, it hit me too.
No, all of those preventative care things that I talked about, that impacts hypertension. When you are stressed, that blood pressure shoots up. So if you keep your body in a constant state of stress, you're always going to have some type of health ramification from it. If you're not watching what you eat, if you live in a food desert and all you have access to is McDonald's, that means you do have to figure out a way to take that extra step to incorporate some more fruits and vegetables. You know your body needs it. Even if you don't like it, you know it's necessary for a full life. So those choices, that helps fight against obesity. And obesity is a silent pandemic that's been running rampant across the country that impacts your mental health as well. So all of those things, like we started talking about at the very beginning, that's how people can start taking care of themselves on the preventative side to get back to, what's the opposite of frailty? Agility, maybe? Yes, exactly. To get us back agile and ready to be mobile and to move around. You need to stretch, Yes. I'm glad you said that, because a lot of us carry that weight all the time, and that internal weight, it starts to get real when you feel it in your knees and in your back. Yes.
It's a mask. We are good at masking. And I was going to say, when you mentioned McDonald's, you had, apples and oranges are now cheaper than McDonald's.
In that, finally.
Right.
Finally.
So it's no excuse.
Yeah, right.
Yeah.
Well, folks would say, well, that's all we...
Yeah, there's no excuse now.
But we're here.
Yeah, no, thank you guys so much. I love these type of conversations. They are tough, but they are so necessary, because they literally save lives, you know. So thank you so much, Dr. Jordan, for joining me again. It's been a minute. Don't be a stranger.
Yes.
And Dr. President Clee Jackson, thank you for bringing your expertise and all that you do. We appreciate it. We will take that charge. Thank you. And thank y'all for tuning in and listening with us. You can go ahead and listen on YouTube or on Spotify. And we appreciate you for tuning in, and we'll see you guys soon.